lobes like this. These are called lateral lobes, and they are connected by a tissue structure that is called isthmus, and this is lobe. So two lateral lobes connected by the isthmus, and that's the thyroid. Now, thyroid gland produces three hormones: T3, T4, and calcitonin. So these are three hormones produced by the thyroid gland: T3, T4, and calcitonin. T3 is also called triiodothyronine. T4 is called tetraiodothyronine. Now you tell me, if I ask you, this is just common sense. Triiodothyronine, that's why it is called T3, right? Tri means what? 3. Tetra means 4. Okay. So T3 and T4. Now, from the name, tell me, in T3 hormone, how many iodine is there? 3 or 4? 3. In T4, how many iodine is there? 4 atoms. Okay. So to form one T3 molecule of hormone, one molecule of T3 hormone, you need how many iodine atoms? 3. 3 iodine. And 3 iodine atoms bind with the amino acid that is called tyrosine. Just know that tyrosine is an amino acid. So that's how T3 is produced. 3 iodine atoms bind with the amino acid called what? Tyrosine. Is it clear?
What's the name of medicine, isn't it?
Which one?
Tyrosine for someone who already removed their thyroid.
Mm-hmm. So if someone has a lack of thyroid hormone production, then you will provide iodine and tyrosine. Yes. Then production will be increased. So that is T3. To make one T4 molecule of hormone, you need how many iodine? 4 iodine, right? Atoms and tyrosine. Same amino acid, tyrosine. Okay? So that's the difference. Very little. Like in case of T3, you need 3 iodine atoms, and tyrosine, in case of T4, you need 4 iodine atoms and tyrosine, the amino acid. Now you tell me, lack of iodine will produce more thyroid hormone or less? Less. Makes sense? Because iodine is needed to produce T3 and T4. Is it clear? So if someone has lack of iodine in the food, body is getting less iodine, right? Production of thyroid hormone will be less. Hypothyroidism. Make sense? Or if someone has less tyrosine, that will do the same. Okay, that is called hypothyroidism. Less function, hypo means what? Less, right? Function of thyroid gland, hypothyroidism. Now you tell me, if someone's thyroid gland works more, that should be termed as what? Hyperthyroidism. Hyperthyroidism. T3 and T4, so you will hear both hypothyroidism, hyperthyroidism. Okay? More function or overfunction of thyroid, less function of thyroid. T3 and T4, these two hormones. By the way, another name of tetrahydrothyrronine or T4 is thyroxine. Okay, so thyroxine is another name of T4. Now, these two hormones, T3 and T4, they are very important. Why? Because they increase the metabolism in the body, increase metabolic activities in the body. Increase T3 and T4, they do what?
Increase
Metabolism or metabolic rate or metabolic activities in the body. Make sense? Okay. Now you tell me, in hyperthyroidism, the metabolic activities in the body will be always increased. Make sense? High metabolic. When you are even in resting condition, right? If you have hyperthyroidism, the metabolism is high. Make sense? So, what should be the symptoms in the body? Like you are in hyperthyroidism patient, you are sitting in resting condition. If I take your heart rate, if metabolism is high in the body, heart rate should be high. You know that, right? How about the body temperature? High. You know when metabolism increases, right? Temperature increases, heart rate increases, blood pressure increases, right? Make sense? So those are the signs and symptoms of hyperthyroidism. Increased heart rate, increased blood pressure, increased metabolic activities, increased body heat. Make sense? Body temperature. In hypothyroidism, all these will be what? Opposite. Make sense? The heart rate is low, blood pressure is low, body temperature is low. So if you touch the surface of the body, you will feel cold in hypothyroidism. Hyperthyroidism, body is always a little bit warm. Make sense? Now you tell me, prolonged hyperthyroidism. If in your body 24 hours metabolism is high, right? You will gain weight or lose weight. Lose weight, right? Because metabolism uses fat. Excessive metabolism will use eventually the fats of the body, right? So the person will be what? Skinny. Make sense? Weight loss. The person will have sleeplessness, less sleep, and easily will get what? Tired and cranky, irritated. Easily will get irritated. So don't think I am like that. Okay. So
you get 4 hours of sleep.
Okay. So somebody is sleeping.
She gets 6 hours.
Yeah, I think she worked night. Okay. So those are the signs and symptoms of hyperthyroidism, right? This heart rate will be high or increased heart rate, increased blood pressure, right? Increased sleeplessness, increased irritability, right? Weight loss. Those are increased heat in the body. Calcitonin. This one is not related to metabolism. This one has different function. It lowers the blood calcium. Calcium in the blood. Lowering the blood calcium. Okay. So let's quickly review. Who is the master gland? Pituitary, right? And pituitary controls the other glands of the body, endocrine glands of the body, right? That's why it is called the master gland. Another name of pituitary is what? Hypophysis. Very good. Pituitary has how many lobes or parts? Two. Anterior and posterior. How many hormones come from anterior?
6.
How many hormones come from posterior? 2. Okay, good. Growth hormone comes from anterior or posterior? Anterior. It works on almost all tissues of the body, but on 2 tissues the action is prominent more. Bones and skeletal muscles, right? Excessive secretion of growth hormone during the growth of the body will cause what? Less secretion, dwarfism. Now, if growth hormone secretion is normal during the growth of the body, but in adults, if growth hormone secretion is more, then that will cause what? Acromegaly. Okay, you know the signs, right? Thickening of the certain bones of the body. Yeah, facial, finger bones are more clear. Okay. Posterior pituitary releases 2 hormones, right? One is oxytocin, another is antidiuretic hormone. Okay. Now, thyroid. Thyroid is located in the lower part of the neck, right here. How many lobes it has? 2. Lateral lobes connected by isthmus. Now, thyroid gland produces how many hormones? 3. T3, T4 and calcitonin. Make sense? This is the thyroid gland. Now, if I see inside the lobe of the thyroid gland, I will see many finger-like structures like this, filled with these finger-like structures. These are called follicles. So, many follicles are inside the thyroid. And now, in the wall of the follicles, you have the cells. These are called the follicular cells. Makes sense? These are the follicular cells. So let me write it down. Follicular cells. And in between the follicles, you have another type of cells outside of the follicle, in between the follicles. These are called parafollicular cells. Parafollicular cells. Okay? Just know that follicular cells secrete T3 or produce T3 and T4. And parafollicular cells produce calcitonin. So those cells are in the wall of the follicles. Those are follicular cells. Those cells are in between the follicles, parafollicular cells. And they secrete those hormones. Now, the amino acid tyrosine. From where the amino acid tyrosine comes? If I take a follicle and cut it, like, if I cut the thyroid gland here like this, not a follicle, the whole lobe, if I make a slice like this, these are the follicles. So what I will see? I will see like this. This is the whole lobe, and these are the follicles like this, because I have made a cross section. So these are the follicles, and these are the follicular cells in the wall, and these are the parafollicular cells in between the follicles. Makes sense, right? These are parafollicular cells. And inside the follicles, you have the protein called colloid. And that protein has the amino acid tyrosine. So colloid is the protein, and you know that protein is formed by amino acids. So you have tyrosine, that amino acid located inside the follicles. All these follicles are filled with protein, that colloid. Okay, so that is the tyrosine, source of tyrosine. Make sense? Okay. Now you tell me, if tyrosine is not used to produce T3 and T4, what will happen? That tyrosine will start to accumulate inside these follicles. Make sense? If they are not used up, then they will start to accumulate inside the follicles. And all these follicles will get what? Bigger, right? Tyrosine will accumulate and follicles will get bigger. So when all the follicles get bigger inside the thyroid gland will get what? Smaller or bigger?
Bigger.
Bigger, right? And that is called what? Clinical condition. Sometimes you see the thyroid is big like this. Here in the you don't see many, but if you go to a third world country where kids suffer from lack of iodine, if iodine is less, tyrosine will not be used up. Make sense? Because tyrosine binds with iodine. So tyrosine will not be used, so will accumulate, and that is called goiter. Have you heard that? Goiter is the enlargement of the thyroid gland, and happens usually due to lack of iodine, because iodine binds with tyrosine, so tyrosine will not be used up, will start to accumulate inside the thyroid gland, inside the follicles, and that causes the goiter. So here you see follicular cells in the wall of the follicle. These are the parafollicular cells. Here you can see these are the parafollicular cells in between the follicles. And colloid is the protein inside the follicle. And that colloid has the tyrosine amino acid. Make sense? Okay. Here you see a patient of goiter. The upper picture, enlargement of the thyroid gland. Now, if this person, this kid, get enough iodine, if you give iodine supplement, then what will happen? Excess tyrosine will quickly bind with iodine, right? And will be released as T3 and T4. Make sense? So the thyroid will get smaller. Make sense? So easy. If you provide iodine rich food or iodine supplement, the goiter will be gone. Okay. That is hyposecretion that will cause the accumulation. Another clinical condition that is called myxedema, that also occurs due to hyposecretion of thyroid hormones. Myxedema, just know that myxedema patients get fluid, accumulation of fluid in the tissue. So edema, particularly if you see the face of that patient, face becomes puffy, soft, like edematous face, like fluid has accumulated in the face. Okay, so puffiness of the face. Hypersecretion, prolonged hypersecretion can cause a clinical condition that is called Graves' disease. Graves' disease is a result of hypersecretion of thyroid. Now you tell me, I already mentioned, if thyroid gland works more, hyperthyroidism, right? Hypersecretion. If that happens for a long time, the person's body weight will go down or up? Down, right? Down. The person will lose the body weight because metabolism is always high, right? So fats are being used up, right? So the person will be very skinny. Another thing happens, of course the heart rate will be high, blood pressure will be high, where this is a very, visible sign, protruded eye. Like eyeballs are coming out, pushed forward. Why that happens? In Graves' disease, fats start to accumulate in some locations, abnormal locations in the body. Particularly, fats accumulate in the orbital fossa, in the back of the eyeball. Your eyeballs are here, right? Your eyeballs are here. So in the back of the posterior of the eyeball, fat accumulates. Okay? So that will push the eyeballs outwards. Make sense? So when you look at that patient, you will see the eyeballs are like, big, coming out. That is a sign of Graves' disease. Okay, so we have talked about the calcitonin, its function, produced by parafollicular cells, right? In between the follicles, these cells produce calcitonin. Okay, so let's stop here. If you have any question, no? You understood everything? Most of the things? Okay, that is good. If you understand most of the things,